So good morning, everyone. My name is Liza Gundell. I'm the CEO of the Family Resource Network. FRN is a network of organizations including Autism Family Services of New Jersey, Caregivers of New Jersey, and Epilepsy Services of New Jersey. We serve people across the lifespan living with intellectual and developmental disabilities, blind and vision impairments, autism, epilepsy, and chronic health conditions in all 21 counties. COVID-19 has impacted our organization and has impacted the people we serve. Despite the efforts to practice all health and safety guidelines, we lost 4 people we serve to the pandemic. Access to PPE is essential in the Herculean effort to stave off the contracting of COVID-19. Locating, accessing, and funding PPE has and will continue to be a challenge for us. This is an area where we absolutely need help. Direct support professionals working in group homes have received enhanced compensation for their risk in serving people with intellectual and developmental disabilities throughout the pandemic. But direct support professionals serving individuals living in their own homes got nothing. The death rate for individuals with disabilities living in their own home is more than double of those living in group homes. My staff continue to go into families' homes and provide essential services to the most vulnerable of our citizens, putting themselves at risk every day. They deserve to be compensated appropriately, just like all the other essential workers. Despite efforts to provide enhanced technology to people in New Jersey, the lack of access to technology is a significant barrier for the people that we serve and for our employees, particularly those living in lower income or rural areas. These individuals have been disproportionately impacted by the pandemic and their access to services. Where we are able to provide virtual services, these individuals have even less access to services and supports than those who have access to the technology they need. Virtual services don't work well for all individuals with disabilities, but they do work for many. However, some services like after school or socialization and recreation programs for children have not been approved to be provided virtually to students with autism who may need assistance after school or with support to complete their work remotely. Having these services would provide more work for direct support professionals and greatly benefit the children we serve and their parents who are struggling to manage work, school, and home life. We are anxious for in-person services to open for the people we serve and for our staff. People with disabilities, their families, and the workers that support them need access. Access to pay for our essential workers, access to resources like PPE, access to technology and broadband high-speed wireless communication in our communities, access to supports and services for the people we serve, and access to open up services so all of our direct support staff can work. I want to thank Michelle also for giving us the opportunity to participate in this town hall meeting, and thank you to NJBIA.